Brett.
Joseph.
Chris. Austin.
Alright. Do you remember the days when you were sitting in class, maybe taking a test, and the kid in the back would not sit still? You can hear the constant tapping of a pencil, and in the corner of your eye, you see them fidgeting and trying with all of their might to focus on the task at hand. The kid in the back might have ADHD. Today, I'm going to discuss the different aspects of this disorder. Dealing with ADHD begins with noticing symptoms, getting officially diagnosed, and finally finding the treatment that's fit for that particular patient. I know this all too well because in August of 2014, I was diagnosed with ADHD, attention deficit hyperactivity disorder. As a child with ADHD begins to develop, you may notice some of the telltale signs that something may be awry. It is important that parents watch these symptoms closely so they're not mistaken for regular, average childhood hyperactivity. Journalist Robin Medell for Healthline.com states that one of these warning signs could be an inability to sit still for calm activities like eating or having books read to them. Writing down any signs you might catch is a good way of tracking the progress of this disorder. This can determine if the problem is bad enough that a psychologist should be consulted. You should always write down the times that the symptoms occur and what they are. If my family had known these signs earlier on, I could have received earlier treatment that could have made school a little easier. Patience is key to finding a solution to this problem. Sometimes doctors can be really expensive, and it's hard to go if you're not even sure if there's a problem. But the process from diagnosis to treatment can take years, and it will be worth it for your child. The next step in this process is finding a diagnosis. After watching your child's symptoms grow, it's time to choose a doctor. Ask around to your friends and family to hear about the doctors they like, and if none of them sound right for you, do some research to see if there's any ADHD specialists in your area. If not, go to a doctor that you've trusted for a long time and tell them everything and anything you've noticed in your child. There will be a long series of tests and tasks which can make it difficult to diagnose a toddler. Remember that the main goal is to get treatment, so the painstaking process is really going to be worth it. There's sometimes a long waiting period to receive the results of the tests, but once you receive the results, you can finally take action. Your doctor will discuss different methods of treatment with you. The most important step in this process is finding treatment that's proper for your child. One of these treatments is behavior therapy. According to the Centers for Disease Control and Prevention, the goals of behavior therapy are to learn or strengthen positive behaviors and eliminate unwanted or problem behaviors. Another option to consider is medication. This is one of the more controversial options for patients who are still children. But it could be the sole solution to the disorder for your child. Everyone reacts differently to different medicines. The option I ended up finding the most helpful was school accommodations and interventions. This allowed me extra time when I was taking tests, and the teachers helped me to stay organized and attempted to eliminate any distractions in the classroom. And I would often have one of these. It's a Tangle toy. It kind of helps you focus so you can fidget with it while you're taking a test, and it's not much of a distraction to other people like tapping a pencil. And it would help me stay focused so I could finish whatever I was doing on the same time as everyone else in the class. Oftentimes, 2 or more of these methods can be employed to make the proper difference in the child's life. ADHD can be a very difficult disorder to diagnose and treat, but hopefully after hearing the steps to finding proper treatment, it will give you a better insight if your child happens to display any indicators. This disorder does not have a cure, but there is still hope. It's important to remember that no one chooses to have this disorder, and it's definitely not a result of poor parenting. All the perfect parenting in the world could not solve this disorder by itself. I'd like to leave you with a quote by Nelson Mandela. He says, "Do not judge me by my successes. Judge me by how many times I fell down and got back up again." Attention deficit hyperactivity disorder is a long journey of trial and error, but if you focus on the positive aspects of this disorder, you will have more joy than pain.